Bunion surgery is perhaps the most common foot surgery procedure in the UK. Bunions affect around 1 in 3 people and are 5 times more common in women than men. With advances in technique and modern anaesthetics, bunion surgery is generally very safe and relatively pain-free. The experience of foot surgery should be comfortable and relaxed. If the patient is having surgery under a local anaesthetic, the patient will remain awake throughout the procedure but will be shielded from the actual surgery. Surgery should always be carefully considered, and it is very important that you understand all the risks and potential complications which can happen with surgery and the recovery process following the procedure. It is really important at the consultation that you give as much information as you can to your consultant about your symptoms. This will help the surgeon to make an accurate diagnosis. Your consultation is also the opportunity to ask the surgeon as many questions as you have. You should leave feeling reassured that surgery is the right option for you. All our patients are x-rayed as part of the consultation. Here we are able to look at the malalignment of the bones involved or bunion deformity. There are lots of different procedures we use to treat bunions, and the x-rays will help us to determine which is the most appropriate for you. Patients have a choice of general anaesthetic where they are fully asleep, or a local anaesthetic where the foot is numbed and the patient is fully awake. The anaesthetic block is given either at the level of the ankle joint or behind the knee. In the operating theatre, we start by making an incision on the inside of the big toe joint which hides the scar, so scarring is minimal. We then remove the large bunion bump on the side of the big toe joint. After that, the bones on either side of the big toe joint are cut and realigned into their correct anatomical position and fixed with special bone screws and pins. This secures the bone in place whilst it is healing. The big toe then appears straighter and the foot is narrower once the swelling has settled down. This should give the patient more footwear options. Throughout the procedure we can assess the position of the bones to ensure that they are in the perfect position with the use of an X-ray scanner during the surgery. Finally, the wound is closed and the foot is carefully bandaged for protection. The patient is then free to relax in the recovery room. Your experience of bunion surgery should be relaxed and totally pain-free.
A side of me I've never seen before.